So in another way, we have to check for, this is, we look into the caries. We have a very strong thing, what we call it a non-carious tooth loss. So research, this was done in 2012. We check for something called an apifractions, and it is a loss of a non-carious tooth loss. And if we look on these trees, the patient come. Here in Sudan, we have two problems. Besides the caries, we have very aggressive brushing habits. Okay, patient tend to be very stressful. This is, we can see here, this is a site for apifractions in the neck of the tooth. Okay, so to examine this, the main thing finding this was an MSCC research work, and we had to check for the apifraction. Internationally, it doesn't reach to the 8. It is like 5 and 6. But the outcome of this research found that it is here in Sudan, the presence of apifraction was 9.4. To distinguish it from any other type of non-carious tooth loss, we had to do a very simple examination by using a wax pattern. The characteristic of this apifraction lesion is a wedge shape. So what did we do? We used a simple inlay wax, and we did an impression, and it's a duplicate of the oral cavity. And as we can see here, this is, we did it, and we brought the wax, and then we placed it, and then we took it out, and it is exactly the V shape what the books say. So when we say it is 9.4, it is actually a real 9.4 because all the cases we did it and it was examined for, it is a real case for apifraction. I really do apologize for a non-dental colleagues. It's a little bit boring, but I'll try to make it very simplified. Endodontic, it's a root canal treatment, and it was an MSCC student's work. It is about the root and the canal morphology of the permanent mandibular molars in Sudanese population. We were all taught foods. It has got 3 canals, but in the study of way down at the UNIM, the MSCC thesis, we found that we have, and there is a rare occurrence in something called the C-shaped canal. We found that 3% of the examined cases for the Sudanese population has got 3 roots, the first one. A 3-root first one. This is, will change the practice for surgery, for endodontic, for all the practice. The amazing outcome that we found that more than half of the roots does not have 3 canals, but 4 canals. So from here we had an explanation, a simple one, that most of the cases of the endo tend to have a failure because all the dentists, according to what they were taught, they have 3 canals. But when they enter, they found usually there is a miss 4 canal. So this is make it quite a big thing, and then we will come for the coming research to see it. So also the second molar tend to have 10% of the cases has got the C shape. C shape it tend to be more in the Asian community. Rather, it had not been recorded here or in Arab or Africans. So the origin of, if we have a look about the Sudanese patient, we are a mixture for multi-nations. So this is making it quite characteristic. And this is, I always tell my MSCC students, you don't need to take from the clinical practice what the books say, because we can face quite a different challenging case. This is a case for a 3-rooted first molar, and this is a slide for a second molar, and this is really inform us that there is appearance of the second molar C-shaped canal. Here I would like to take the opportunity that to say that this research was conducted with the help of Dr. Nadia Allah Yarhamha, and she was really good in morphology, and she helped us a lot in this work, and I may ask Allah to accept her, inshallah. So another thing we found out, as I said before, we had a question, why the endodontic treatment failed? This is quite a big problem. So we need to see, we have to check in the incidence of apical periodontitis of the filled tooth, and we had important thing. It's not only the coronal. There is a factor that we don't know the morphology. We were told that there is a 3 canal, and then examination we found it's 59%. It's quite a big figure to have 4 canals. So most in the 59%, if the patient received endo, definitely the dentist missed the canal. So if we look through here and we check for the length of the root canal filling and the thing, we found that it's quite above 50, which has been short. Another thing, the acceptability tag of these canals were almost within the 30 something. Another work we took into the practitioners. We had to go back to the faculties. We need to check for the teaching of the dentists. We need to check what actually the treatment by an undergraduate student is. This work was published in Australia, and we had to check for the quality of root canal treatment. And we found that only 24.2 of all the evaluated canals were within the acceptable quality. And this is quite big questions. It is not that I really do appreciate, this research was done with the great help of Professor Yahya. I really would like, no words can express my gratefulness to his helping such work in the endodontic discipline. We found that we need to plan that endodontic in Sudan is a quite part of a dentistry. It should not be a part of conservative. It should not be as a part of operative or restorative. It needs to be a very separate clinical discipline because they impact the teaching. Every day we have new things in concern of the material. This was for the fixed students, and we found 24. Following that, we had to do a research, not only involving the undergraduates of the University of Khartoum, but all the dental students all over Sudan. So we did a research was conducted by undergraduate dental students. They were in 4th year, okay, and with the help of Dr. Abir. So we had to check what are the difficulties they face. And it was investigated, and they have to answer without any pressure and without writing names, and they have to speak frankly what was their problem. Why do they have a 24% a good quality for endodontic treatments? And it comes an amazing thing that they have a problems in isolation of the teeth, aseptics, the use of the rubber dam, proper isolation of the tooth during the treatment, because we know that the oral cavity is full of bacteria. So we need to have a look of the difficulty of these students, not only as teachers, but other than as we are the student themselves, because this is a good component, and we need to examine why do they have difficulties when it comes into endodontic treatment. Another work we have to do is to look into the improvement of the instrument, as we say, material and instrument. And we need to bring research to make us more challenging, make it more challenging for all the endodontists in Sudan, and to have it more appropriate to have a look through the update in the endodontic instruments. So this research was done as part of an MSc thesis, and it is to look through what is the use of the benefit of using a rotary endodontic instruments. And then we found that it is quite convenient, it is not difficult. The MSc students started to work, and now we in the department we started to introduce it for the practice of undergraduate students, inshallah. This is the improvement what we are talking. We introduced it to the postgraduate. This was done. Case was conducted by Dr. Riham, and we can see she used the rotary instrument. which is being used internationally. In Japan, no longer they use the manual, they're using the rotary. And we have it in the Faculty of Dentistry. It's a must for most of the MSc students. And we can see the outcome. These type of teeth, they used to be extracted. So the outcome is an excellent, no longer need for extracting the tooth or removing the tooth from the oral cavity. This is another case, and maybe there's a lot of surgeons here, they're debating that this is indicated for extraction, but I'm really sorry, we treated and we didn't refer it to the surgery, and this was the endodontic treatment, and it was successful, and we are recalling the patient for a follow-up after the treatment. Another work was done by a part of MSc students by Dr. Hajar al-Idrisi, and this is to examine the coronal microleakage of the material. In this research, we did what? We didn't brought all the names. We had to check. We have a difficulty here in Sudan to get the up-to-date, the best material. We use the material available in the market. We use the ready-made material, and we use the hand-mixed material to check, are they appropriate? We have a lot of material available in the market, and most of the newly graduate dentists, they come to me, Victoria, we found this and we found that, and we need your advice. Do you think it's appropriate to use it? Because actually we don't have a committee to check for all the material coming into Sudan. This is quite an important thing. And then we found that there is a quite different if we look into D and to A. This is Indian ink, and we show that there is a microleakage. So if a microleakage of an Indian ink passes through the material, there is nothing can stop the bacteria from passing into the canal. So this is quite an important thing to know, that this type of research we need to conduct more about any material we have in the market, rather than we depend on certain material, we order it to make a good research. No, we need to apply, we implement the research work into our Sudanese community to make it easier for the dentists here in Sudan. Another thing also we brought, this is an MSc, a PhD students, we did it about bringing the comparison between the Epiphany and Gutenberg. It's a new type of endodontic restorative material. So we found that in spite the companies have been talking about this material has got the best and has got a promising, so we need to check it here. This is an extracted teeth, and we check for the microleakage, and we actually found it's a quite promising material, because we are talking about the microleakage, and this research would be of a benefit for any practicing endodontist or any practicing general dentist to use it as one alternative for the Gutenberg. Another thing for the endodontic treatment, we have to check for one problem we all face if anybody has got an endo ear treatment. The main problems in clinical, people usually tend to hate to come back to the clinic, especially if he spent all the night, he didn't sleep. So he just want to finish the pain, and that's why there was a problem in most of the cases. Patients tend to have extractions for the teeth. So there is a new trend for a dentistry that endodontic, you can do it in single visit rather than in more than one visit. And this research was an MSc students, and it was published in the Journal of Endodontics in the United States. The Journal of Endodontics for the people who are not dentists. This is number 3 international journal, and we had it published, and it was accepted in 2 months. And the finding is that this multiple visit and a single visit was conducted by undergraduate students at the University of Khartoum. They did it themselves, the student, and we checked the patient pain. Is there a difference on doing a single root canal treatment in one visit or in doing it in more than one visit? Because all the literature, all the international trends tend to have in a single visit not to expose the tooth to any bacteria. And then we found that it is really that there is actually no significance a first visit because the patient will feel pain. There is not any significance in it. Actually, it has no significance existing in the post-operative pain. They have been equally. So from here we can bring an important thing that the dentist, if they have the chance to do it in a very long visit, especially here in Sudan, we don't have a regular checkup. People tend to escape. So if you have the chance, you just finish it in one visit, and this is, you will keep you safe from losing the patient or losing the tooth itself. When it comes to fixed prosthodontic, we talk about endo, material, and operative. We talk about the fixed prosthodontic, which is artificial replacement, fixed replacement. The astonishing thing is that one of the MSc students did a survey, and it was conducted by Dr. Ala Abdel Wahab, and we found that 65% of the crown of bridge work was failure. The patient come to do a crown or bridge after some times, which is not like the other countries, which the crown fail after 10, 20 years, 15 years. Here, sometimes less than 1 year, and it has to be something related to the practice we're doing. So, in a work, to assess the work of the crown of bridge work, in a way to analyze a simple way, why do we have a 65% failure? We found that most of the dentists, they use the alginate as a final restorative material. Alginate is a type of a material which is not used just to take a study cast or just a simple impression. So here we found it, and it was really amazing because the other finding was that when it comes to disinfecting the impression, and this is a very dangerous thing because if you did not disinfect the impression, you're going to spread the disease from the patient to the dentist, to the lab, to anybody who comes in contact with the impression of the fixed prosthesis. So this is, we can see it here, it's quite high, and this is put an alert for any practice, dental practicing fixed prosthodontic. They should be alert that they need to disinfect the tooth. We go back, this is an excellent, I would like to really thank Dr. Nadia Khalifa. I was her co-supervisor for her PhD. She did really an excellent work, and she helped in the area people. We should have started her work ages ago. We needed to look to the factors which make the people lose the teeth, the status, and we need to check in it. Why do we have people, a lot of young people or a lot of young generation walking out without teeth around in their oral cavity, while internationally you can find these figures completely different. So, and it is really quite important to see that the replacement almost was evident in 3% of the examined population, and this was really shocking. Why people, they don't tend to keep their teeth? Why they tend to extract their teeth? Why they don't go for treatment? And this is quite a big important issue. We need to have a look at it. And so, another work which was published by Dr. Nadia, and it is quite cited by 4 journals, and its finding was published in 2012. So we see here the important thing. It was the pioneer study to check for the disease teeth or the missed teeth or the filled teeth in the oral cavity. All the studies which was conducted by Professor Yahya, they all deal with the children or a young adult, but none extended it like what Dr. Nadia did to the above 75 of age, and we find it's quite a shocking one to look at it. So when it is increasing with age, there is an increase in a disease in the missed tooth. So here can bring quite an alarm that we need to have a proper education for the patient. We need to have to imply that patient need to have a regular checkup, because it doesn't mean that anyone and visit the dentist unless he has a pain. So this is quite important. When it comes to, and this was recently published, and the effect of the lost tools over the, as we saw that we have applied everyone, this is affect the psychology of the patient himself. So this is actually, the results show that 50% they feel less. 50% of the patients who has lost teeth as well. It's not only for the mastications, it's not only, but these missed teeth let the patient have the sensation of feeling tense and self-conscious. And this is quite important. It's not only that, but they have a discomfort, physical pain due to the aching mouth, discomfort from it was like 37%. This is another case. This patient attended, she's very young, in the 20s almost or something. So look at the amount of caries. She got frustrated. She stopped brushing her teeth. An amazing improvement in her oral hygiene. So sorry for giving you, and I know it's a little bit for a non-dentist to have all this time to look into slides of the dental caries and missing teeth. But the valuable outcome of this lecture is that we need to promote prevention community program for the oral health would have a greater impact. We need to prevent more cost-effective than the actual treatment of the disease, and this will implement. It's not only international, it is not only everywhere, but in Sudan, simply in the kindergarten, in the school, in the universities, we need to promote the importance of the oral health. Another time, thank you for the listening. Always grateful to my father who taught me the pleasure of knowledge, to my mother who always supported me, to my family, my brothers, my niece, my nephews, and to my husband and to my son and daughter. Thank you very much.
Thank you, Neamat. Before we start,
Thank you, Professor Yahya. Welcome you all. It's very respect your bias. But it is honorable for me and for us, especially in the Faculty of Dentistry, to congratulate Professor Neamat and the Faculty of Dentistry. Professor Neamat is the first female professor in dentistry in Sudan. Professor Neamat came to the Faculty of Dentistry, University of Khartoum, with highly qualifications from a highly recognized institute, and she worked in the Faculty of Dentistry as her first home, since it is the first highest national institute. She contributed actively in her department division, her department oral rehabilitation, and her division restorative dentistry, which is a great health division which contains 3 specialties: endodontic, as she mentioned in her lecture, endodontic, crown and bridge, and restorative discipline. Really, Professor Neamat contributes actively in all of these disciplines. She is teaching at the different levels in the faculty. She teaches the level 3, level 4, and level 5. Moreover, it works actively with her postgraduate students. She attended the seminar, conducting journal clubs regularly, training the students with close supervision. She used to attend daily. She's always there, available for all who is in need for her scientific and research knowledge. Professor Neamat represents the Faculty of Dentistry in many international and national conferences. Professor Neamat consolidated the scientific relations of the Faculty of Dentistry with the national and international institute. Professor Neamat, she contributed highly in the research, and as you see now in our lecture, she did a lot to serve the discipline and the specialty of dentistry. We are happy for that to be with in this happy circumstance. But unfortunately, during the coming year, we are going to lose Professor Neamat for some time. Or it will be only 1 year. She will be on her sabbatical leave. But with this telecommunication, we will be in contact with her. She will continue with us as she was in the department. Congratulations again to Professor Neamat. Welcome to you all. Thank you.
بسم الله الرحمن الرحيم. الحمد لله رب العالمين. ما زال انا رئيس مواد المكتبين بكليه طب الاسنان ومن reasons. I'm very close to Professor Neamat. I used to discuss with her all the good things she was doing in terms of her research. And it's something to be proud of. For one reason, she has been exposed to 3 different continents to obtain her degree: Africa, Asia, and Europe. And this gives her what we see now as a very distinguished female. And as has been quoted by the acting Dean of Khartoum, that she is the first female in the history of Sudan to acquire or to attend Professor Presentation. Other thing you see, and what she has been saying about the benefit of dental surgery, I was one of the beneficiaries of what she has done, you see. She has rendered to me a lot of services free of charge. I love it. لما أقول مليح ما قاعد بالطريق. I think she was a very good person, you see. I'm very proud of her. And I think you see this distinction of this university. I'm very proud being members of this university. That all the time you see we hatch the best around town, you see. And all the time we don't bet on a losing horse. And I'm very happy that Professor Abdulrahman, the ex-vice chancellor of the university, we know that promotion for the professor is very meticulous in the painstaking process. Whoever earns it, he just gets what he's looking for. I'm very happy to congratulate the faculty of dentistry of dental surgery for having this one. I'm very close to most of the people staff. And it is the pride of dental surgery in Sudan that Khartoum University has got the best around town. As the Deputy Dean said, she's going to leave. She's going to leave for genuine reasons, you see. We are going to miss her physically, but I'm very sure that we are very around us. I would like to congratulate my best friend, Dr. Neil, for having a very outstanding wife. And I'm very happy that both of them are making a very compatible group. I don't want to take much of your time. I want to say hi to all the dental surgeons around here, to those friends in different institutions. And I think this is a discipline that is very nice. Thank you very much, Neamat, and may your travel be very successful, you see. ربنا يعود الفاتح إن شاء الله. Okay, thank you very much.
school. And actually, I want to point 2 points. First,